Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HSHS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
At Carl, we dedicate ourselves to helping you be great. And we have the expertise and inspiration to help you stay that way.
Hi, I'm Keanne Armstrong, and I'm your host of Being Well. And today we're going to be talking about fat loss and all the different things that come into play when you're talking about weight management and different things that you're concerned with. Today on the show I have Dr. Kumar, and he is with HSHS Medical Group in Effingham. Thank you so much for joining us today.
Thank you, Ken.
Pleasure to have you.
Here. Thank you.
So, Dr. Kumar, why don't you talk to us at first here with what department you're affiliated with and a little bit about your credentials.
Sure. Well, I'm with HSHS Medical Group in Effingham, and I'm a gastroenterologist. I did an internal medicine residency at Washington University in St. Louis at Barnes Jewish Hospital. And then I did a gastroenterology fellowship at Harvard Medical School in Boston, followed by an advanced endoscopy fellowship there, and extensive training in bariatric endoscopy, which is a new field in which we do endoscopic procedures for weight loss.
Okay, all right. So we're going to be talking about weight loss some, but fat loss more specifically.
Yes.
So let's get started with, how do you begin weight management?
Well, I'm board certified in internal medicine, gastroenterology, and in obesity medicine, and increasingly gastroenterologists are involved in weight management. It started with bariatric endoscopy, which is a new field in which we do procedures such as the intragastric balloon, where we place a balloon in the stomach for weight loss. But we're also very comfortable with the full spectrum of weight management, from weight loss medications to nutrition, endoscopic procedures for weight loss, and even bariatric surgery. And so we can direct patients to one or more of these therapies in combination for weight loss.
Okay, lots of different procedures and lots of different things to talk about. So let's get talking about the difference between fat loss and weight loss. What's the difference?
Yeah, so as we started treating patients for weight and weight management, we noticed that many patients did not need to lose weight, but they had an area where they needed to lose fat. And so we found that they were turning to high-risk supplements, over-the-counter supplements that are not FDA approved, or they were self-conscious about a part of their body and they didn't have a solution. So we started working on targeted fat loss rather than just weight loss, to offer an option to those patients who didn't need a weight loss medication or an endoscopic procedure or bariatric surgery.
Okay.
And so we found that there are several ways to cause the body to lose fat directly. And the best of these we found was SculpSure. So typically when you gain and lose weight, your fat cells expand and shrink, but the number of fat cells does not change.
Okay. That's interesting.
Throughout your adult life. And so even with diet and exercise, you may shrink your fat cells, but there may be areas of your body that are resistant to coming down in size. And so with a body contouring treatment, you can target fat without targeting weight necessarily.
Okay. Well, you know, this is a source of contention for a lot of people. You know, you have these trouble areas and you're thinking, okay, I've done everything I can and this just isn't moving, it's not leaving.
Right.
So SculpSure, talk to me about that. What is that?
So SculpSure is an FDA-cleared fat targeting technology, and it uses laser to heat fat cells directly. Now, it doesn't apply heat. It's sort of like a microwave. It doesn't get warm directly, but it does warm up the fat cells using laser energy that penetrates into tissue. And once the fat cells are warmed to between 108 and 117 degrees Fahrenheit, they expand enough and they're damaged enough that about 25% of the fat cells die. And then over the next 2 to 3 months, they're removed by the body's lymphatic system. And once those fat cells are gone, they're gone forever. So instead of just shrinking the same number of fat cells with diet and exercise, this direct approach to fat loss removes fat cells entirely and shrinks the area. And then even if you gain weight in the future, those fat cells aren't there to expand with weight gain.
Okay. It sounds kind of painful to me when you're talking about lasers and kind of like a microwave. Is it a painful procedure?
Sure. So it's a laser only, and it's a very specific wavelength of a laser, which will not damage a tattoo or damage the skin. It goes through many types of tissue like blood, but it does warm up fat specifically. No microwave, but just a laser. Patients may feel a deep tingling sensation or a deep warming sensation. So it shouldn't be painful, and it's generally well tolerated by patients.
Oh, that's good to know. I'm sure a lot of people are finding this topic very interesting.
Sure.
You know, I am for sure. It's something I've never heard of, so I'm glad we're able to talk about this. Are there specific areas that this SculpSure procedure works better in or doesn't work in? Or talk to me about the body parts and how this all really works.
Sure. So it's been extensively studied in the lower abdomen and the flanks, in the upper abdomen on the sides of the chest, and in the inner and outer thighs, and it's FDA cleared for those areas.
Okay.
It can be applied to other areas off-label, which are areas that have not been studied by the FDA.
Okay, such as maybe under the arms?
Sure.
Okay,
Under
something
the
like
arms
that.
is one example.
So we're talking maybe some people call it, you know, a generic term like love handles.
Yes.
Things like that. That's sort of the area you're talking about, the middle tire area, a lot of people call it.
Exactly right, yes. And in addition, under the chin is another area that's FDA approved and is coming soon.
All right. So let's walk through the procedure. So from start to finish, what can a patient expect? Let's talk about what you talk about and how you come to this decision, and then walk them through it.
Sure. So it begins with a consultation, and every patient is different and every patient has a different treatment goal. So it begins with a consultation to decide what the optimal treatment plan is, what areas should be treated, and how many times they should be treated in that given area. And once the consultation is done, then we can begin treatment. So we apply applicators, and there are 4 applicators at a time. Each is about the size of the palm of your hand.
Okay.
And those are applied, and then they're secured with a belt so that they don't move during the treatment.
All right.
And then the treatment is started, and it takes 25 minutes to treat an area. And once that's done, another area can be treated right afterwards. The same area can be treated again a month later to 3 months later for a better outcome, and we usually recommend treating an area 2 or 3 times.
Okay.
During the treatment, patients can use their phone, they can read, they should be comfortable during the treatment, and then once the treatment is complete, then the results begin to show in the next 6 weeks or so.
All right. And you said that there's a time frame between 1 and 3 months between the treatments?
Yes, so the same area can be treated again, which we usually recommend a month later, and then a separate area can be treated on the same day.
All right, so is this something where they're clothed? Are they in a gown? Do you have to be exposed, your skin exposed? How does that work?
So only the treated area has to be exposed so that we can apply the applicators in the belt. You don't necessarily need to be in a gown. You can actually come from work, get it done during lunch in the clothes that you're wearing in most cases, and then go right back to work.
Really?
Yes.
So it's that simple?
Yes.
Okay, well that's interesting. You could just go there over lunch instead of going
Sure.
to some drive up and adding more fat.
Right.
So how many treatments should a patient need? How do you know when you're done?
Well, every patient is different, and this is something that we always discuss with patients, and they work with us to create a treatment plan that they would like. We recommend treating an area 2 or 3 times for the best results.
Okay.
But that can certainly be customized based on the overall treatment plan for that patient.
All right. So is this something new? How long has this procedure been available?
So this is relatively new compared with other technologies, and we think it's better than other technologies. It was FDA approved about 3 years ago, but the technology has been under development for many years before that, and in clinical trials in which it showed that it reduces fat size by imaging, such as MRI. Additionally, the technology, the lasers, have been around even before that for tattoo removal and for other indications. The laser type is different, the wavelength is different, so that this will not fade a tattoo. But the underlying technology has been around for a long time. It's just we finally have the technology to directly address fat with this.
Okay. So when you said earlier that the treatment, you need to have like 1 to 3 months to treat the same area,
Right.
Can 2 different areas of your body be treated in the same day?
Yes. So one area can be treated, and another area can be treated right after, and another area can be treated right after that.
Okay.
Yes.
And then let's talk about the results again. Like, what can they expect? A patient expect? Are they going to see immediate results, or is it going to take between the 1 and 3 months before they see some results from the first procedure?
Sure. So once these fat cells are destroyed, they're removed by the lymphatic system like any dead cells in the body. So once the fat cells are destroyed, it takes about 6 weeks to see results in terms of shrinkage of the size of the fat in that area.
Okay.
And full results are seen about 3 months after.
Okay. So does this improve the look of the skin as well?
To some degree it does. Unlike other technologies for fat targeting, this does induce some degree of skin tightening, and that results in a smoother final finish and a more impressive result. Yes.
Okay. So what if some folks have like maybe some cellulite looking, the dimpled marking and different things like that? Does it sort of smooth that out so that's not as noticeable?
Every patient is different in that regard, but we hope so. So the fat gets melted during the treatment, and so that has the potential for resulting in a smoother finish. Additionally, the skin is tightened over that area, so we would hope that cellulite can be smoothened out with this technology.
All right. What about stretch marks and visible marks on the outside of the skin?
Yeah, so in terms of skin pigmentation, this will not change any skin pigmentation. Stretch marks, if they're uneven and irregular, this may smooth those out. But for those things, other than fat size reduction, every patient would be different, and that's something we can talk about during the consultation after seeing the area that's going to be treated.
Okay. Now, is there a difference between age or gender when it comes to this procedure?
No, not really. So the technology targets fat directly, basically no matter where it is on the body, no matter what the skin is like over it, whether there are tattoos over it or not. And age does not make a difference, and gender does not make a difference. So this is something that we found many women are interested in, but works perfectly well for men as well.
Okay. Well, that's good to know for all of our viewers who are watching.
Sure. Now, we do recommend that patients are over 21 when they have this procedure.
Okay.
But there's really no upper limit to the age at which this is effective. And over time, hormones change. Where people put fat on their bodies changes with hormones and with aging. And so we've found that over time, there's interest at all age levels for this procedure.
All right. So after one of these procedures, you said it could be taken over a lunch hour, you could go back to work, different things like that. What about activity? What if someone is going to the gym, working out, or they've got some activity planned afterwards? Is there a limit on what they can or cannot do?
There really are no limits on this. So patients can go right back to work. They could go to the gym right after this procedure. There aren't any real limits. Now, after the procedure, they may feel some soreness, like they did a workout the day before, so that may limit their physical activity, but there really are no inherent limitations afterwards with this procedure.
Okay. So then also, when you're having a consultation with a patient, they decide this is something they want to do, They go through the procedures, and then they kind of get the results that they want.
Right.
Then what? Do you talk about, diet, exercise, things like that to help maintain, or what happens afterwards?
Sure. We can talk about those things because we're specialists in that area. We do recommend optimizing diet and exercise because any fat loss induced by the body in a natural process will only enhance these results. And maintenance of these results over time is probably enhanced by a healthy diet and healthy lifestyle as well. However, once this technology kills those fat cells are gone forever, and essentially you don't have to do anything in addition to achieve these results. These results are achievable with the procedure alone, but again, we do recommend optimizing diet and exercise for health reasons.
Okay, so once those fat cells are gone in that area, does the body try and put fat cells elsewhere? Is it like, oh no, what happened to that? And does the body react kind of weird or in a different, manner than what we would expect?
Sure. No, it doesn't try to replace the fat cells in that area. It may not even be aware that they're gone. Now, when you lose weight with diet and exercise and your weight has decreased, your body does try to decrease your metabolic rate. It does try to maintain your weight, and it does try to bring your weight back up to where it was before. So that's why weight loss with diet and exercise is difficult, and over the long term may be hard to maintain for a lot of people. And that's where this technology is useful. This directly gets rid of the fat, and it is not affected by where the patient was before the procedure.
Okay, so we're talking about fat loss and not so much weight loss, but do you lose weight with this procedure?
Not a significant amount. Fat is not very heavy. So weight loss with this procedure, would be minimal. It wouldn't be an indication for this procedure. Weight loss can be achieved by other means more effectively. And weight loss in conjunction with this procedure is a great idea. But not everyone who has this procedure even needs to lose weight. You have people who are perfectly at a normal weight, should not lose weight really. They're right where they should be, but still have an area of fat that has not gone away with diet or exercise. And this procedure is perfect for that as well.
Okay. So are there side effects that a patient should be concerned about when thinking about this procedure?
Sure. So after the procedure, patients may notice some redness, some swelling, some nodularity, soreness, and various other things in rare cases. But those things are usually transient. We don't have many patients saying that they have any issues afterwards. So the procedure is generally very well tolerated.
Okay. So is there anyone at all who should not have this procedure done?
Sure. So some of the contraindications include current pregnancy, prior use of gold therapy, a sunburn in the area that's going to be treated, shingles in the area that's going to be treated, and there are a few other uncommon ones, but in general it's widely applicable.
Okay. Now, some people might know what gold therapy is, but I'm unsure what that is.
Sure.
What is that?
Very uncommon and was used a long time ago for treatment of arthritis.
Oh, okay.
We don't usually encounter anyone who's had gold therapy before.
Okay. So if someone's watching this program and they're thinking, hey, this is something that I'm interested in, what would be the first steps to get this information or look into doing this?
Sure. They can call us for a consultation, and we will meet with them and look at the area to be treated and work on a treatment plan and decide if the procedure is right for them, and if so, which areas should be treated and how many times. They can contact us at 217-540-2350 to make an appointment for a consultation with a specialist in this area.
All right. Well, that's good information to know. So very interesting topic. And I don't know, we hear about all these different programs, like you said before, in these procedures. You hear liposuction, all these different things. How does this compare to something like liposuction? That's completely different, right?
Sure. Liposuction is completely different. We call this lipolysis because we're lysing the fat cells. We're basically popping the fat cells. Liposuction is suction of the fat cells and actual physical removal of them. Now, liposuction does require an incision, and then a catheter is placed in and it suctions out the fat. In some cases, there's an adjunct therapy to melt the fat before it's suctioned out. So liposuction is more effective and it's more immediate. However, it's also much more invasive. So once you make an incision in the skin, there's risk of bleeding and infection afterwards. And the cost may also be higher because some kind of anesthesia may be needed. So this is, like liposuction, a method for direct fat targeting and not weight loss. But unlike liposuction, this is entirely non-invasive, non-surgical, and you can go right back to work immediately afterwards, and it does not involve breaking the skin.
Okay, now you said that the fat cells are gone with the SculpSure procedure forever.
Yes.
Same thing with liposuction, or do they come back?
Same thing with liposuction. One of the advantages of liposuction is it removes fat cells forever, it physically removes them forever. And this procedure does that as well. The main difference is liposuction is removing them to the external environment, and with this procedure, the fat cells are exploded so that the lymphatic system can remove them internally, and that way the skin remains intact so that there's no bleeding and no risk of infection.
Okay, so where does the fat cells actually go when you say internally?
Sure, so once the lymphatic system removes dead cells of any kind, which it's doing constantly all the time, and including fat cells after SculpSure, they're put into the lymphatic system, which is like the veins. It has many branches and it has a central lymphatic vessel where they're carried to and then they're disposed of.
Okay, all right. Well, we have about 4 or 5 minutes left, and we've talked about this procedure a lot. Are there other topics that you'd like to discuss shortly before we end the program today?
Sure. One of the most important things that we do as gastroenterologists is screen for colon cancer. So colon cancer is the third most common cancer in the United States. It kills more people in the United States than car accidents every year. It's about the same number of people who would die if there was an airliner crashing every 2 days year-round. So a lot of people are affected by colon cancer. And a lot of that is unnecessary. We can prevent colon cancer with colonoscopy. Unlike a mammogram, which tells you if you have cancer or not, a colonoscopy can actually remove your colon polyps when they're small before they have a chance to grow into a cancer. And if everyone would have their colonoscopy on time and the subsequent colonoscopies on time as recommended to remove polyps regularly when they're small, much fewer people would get colon cancer than do now. And it's like weeding a garden. Remove the polyps when they're small regularly so that they don't have a chance to grow into a cancer. This is one of many technologies to screen for colon cancer, but unlike all of those other alternatives to check for colon cancer, like stool tests to check for colon cancer, colonoscopy actually goes in and removes the polyps so that they can't turn into cancer. And we think that's extremely valuable. It's an advantage over prostate cancer screening or mammograms, which can't actually prevent cancer, they just check for cancer. So we recommend that everyone have a colonoscopy at age 50, although the guidelines may soon change to age 45 because we're finding colon cancer in younger and younger people. And then have a colonoscopy as recommended afterwards, depending on what's found during the colonoscopy. And patients with a family history of colon cancer may need a colonoscopy much earlier than 50. And patients with inflammatory bowel disease like Crohn's disease or ulcerative colitis may also need a colonoscopy earlier than age 50.
Okay.
So it's something to talk to your doctor about. The main reason that people don't have a colonoscopy, once they're found to have a colon cancer, they say, my doctor never talked to me about it. So we're doing that today.
Okay, so more awareness. Go, no matter whether you're male or female, go by the age of 45, is that what you said, or 50?
50 for now.
50 for now.
One society has changed that to 45, and we suspect that the American Cancer Society will follow soon.
Okay. All right. Well, it's not something that I think people find, like, hey, this is something I really want to do, and they try to avoid it a lot of times, and they find that it's something that they don't want to prep for, and they hear horror stories, things like that.
Well, the preparation is not nearly like it used to be. So we often have a much smaller volume preparation. It's much more tolerable. It doesn't have a taste. You can mix it in anything. And the procedure is not bad at all. A lot of patients say that the preparation is worse than the procedure. In fact, a lot of patients wake up after the procedure and think we haven't even done the procedure yet because they went to sleep and then woke up in the same place. They don't feel anything. And we have to show them the pictures to show that we really did do the procedure. Additionally, we use carbon dioxide insufflation, and we use water instead of air to blow up the colon on the way in. So it's much more comfortable than it used to be.
All right. Well, good information today. We've learned a lot about the SculpSure procedure. We've learned about be aware of colonoscopies and get those done as recommended. So lots of great information. It was a pleasure having you on the show today.
Thank you very much.
Thank you so much for your information as well. And thank you for tuning in to this episode of Being Well. For more information, check out our website at weiu.net and click on Being Well. Thanks for watching.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
At Carl, we dedicate ourselves to helping you be great. And we have the expertise and inspiration to help you stay that way. Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HSHS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.